Haemoglobinopathy and COVID-19. What's my risk? Many patients with anemias have been shielding and taking additional precautions to avoid contracting coronavirus. As lockdown eases, finding the best course of action may feel confusing, frustrating, or scary. Since March 2020, a national group of doctors and nurses looking after people with inherited anemias have been collecting data on the number of cases of COVID-19 among their patients and recording what happens to people who get it. So, here's a breakdown of the facts and figures courtesy of the UK National Haemoglobinopathy Panel. From the period of March 2020 through to January 2021, among patients with haemoglobin disorders, 555 had suspected or confirmed COVID-19. That's from a total of 11,430 sickle cell patients in the registry. Of those 555, 91 were children, here defined as those 18 or younger, with the remaining 464 being adults of 19 years plus. Of those treated in the first wave of COVID-19, 94.5% recovered or are recovering in hospital, with 5.5% of cases sadly resulting in death. In the second wave, 99% recovered or are recovering in hospital, with only 1% resulting in death. By this point, more was known about the disease and treatment developed, resulting in a marked improvement. But what about people with other types of anemias? Well, 81 thalassemia patients have been affected, of whom, again, 94.5% have survived. Only 9 patients with other rare anemias were affected, and all of those have survived. Let's look at some conclusions from this data. 2/3 of all patients with COVID-19 are managed at home, and most COVID-19 cases have been clinically mild. Very few children have been infected. Very few of those have required respiratory support, and none of them have died. Similar to what has been seen among the general public at large, those who did badly with COVID-19 were generally older and had other health problems such as high blood pressure or heart disease. With this in mind, what can you do to stay well? Continue to focus on physical and mental health in all areas, as this is important. Take prescribed medication, work to improve your diabetes, exercise, and eat healthy food. And of course, the most important thing, when you're offered the vaccine, please get it. Whether you are offered Pfizer, Oxford AstraZeneca, or Moderna, all vaccinations on offer are safe, as declared by the UK and European medical councils, as well as the World Health Organization, or WHO. Speak to your doctor if you have any questions about vaccination. Thank you, and be safe.